Hi there. My name is Blayne Rush, and I'm with Ambulatory Alliances. We're here answering questions that we've received from previous webinars, via email, or from a phone call. But I wanted to introduce myself and our firm before we get started. We're a full-service healthcare investment banking and M&A brokerage firm that has significant experience in advising physician practice owners and owner-operators of outpatient centers. Have close to 18 years of healthcare experience with considerable expertise in the area of business transactions, revenue enhancement models, complex negotiations, and financial analysis and valuations. I worked with over 250 organizations on transactions. I hold a master's degree in health promotions, a MBA, an executive certificate in the private capital market from Pepperdine University. I'm also a certified valuation analyst and have significant coursework towards a graduate degree in negotiations and mediations from SMU. I hold multiple FINRA licenses, Series 79, 63, 24, 82, and 99. I am also a licensed real estate broker, an active credentialed mediator and arbitrator. If you'd like to discuss your unique situation or have any questions, please feel free to reach out to me. I want to commend you on investing time into learning more about your business, your growth potential transaction. Now let's get started with the presentation and the question. The question today is, what are some of the urgent care red flags that you have seen? Let's start out with one that's fairly important, and I've actually been involved with a transaction that, while it didn't kill the deal, it caused some challenges and it put it in the ditch, so to speak. So you want to shore up your providers before you go to market. While some of the operators do buy centers that have operational improvement needs, the truth is that the majority of the urgent care operators are not set up to do turnarounds, nor do they have a large provider recruitment team. This is especially an issue in the secondary and tertiary markets where extra providers are in short supply. This topic, like I said, almost was a deal killer for one of the transactions that I completed. We had 3 PRN fill-in staff that covered for what amounted to a full-time equivalent person. We had to convince them, meaning the providers, to sign provider agreements that covered 6 months post-transaction with options for longer. Because, again, it's tough to find some of those providers in those secondary, tertiary markets. Consolidated financials and operational data. For multiple centers or clinic opportunities and ancillaries, buyers don't want to see consolidated financials and data that makes it unclear how one center is doing compared to the other in the company. Additionally, if you have centers that are less mature than, say, some of the others, and you can demonstrate that the newer centers are growing and are on track to achieve strong financial performance, you do not want to have consolidated financial and operator data. You as a seller need to make it easy for the buyers to see the value of each center, each clinic, or any of the ancillaries that you're selling. And you need to be able to prove up the growth rate of the various business lines or clinics. What you want to do is have income expenses by class being each of the different clinics, centers, or ancillaries, and that have them separated. They can be on the same financial, same QuickBooks, but you want to have them separated out where they show each of the different centers all of the in and out dollars. If there's shared staff, you want to go ahead and share the staff on the financials. You also want to conduct a billing, coding, and collections audit. Buyers are going to audit your coding. All buyers are going to do that. They're going to audit your billing collections. You want to do this up front during the preparing to sell stage. This will give you time to make any needed changes to your operations prior to buyers looking under the hood. This could also show you that you have been leaving a significant amount of money on the table and then allow you to capture that so-called found value at the time of the transaction. The buyers aren't going to tell you that you have not been using the correct code unless you've been overcoding. And this actually happened to us. We found that one of our seller clients had not been using a nights and weekend code, that's an added code, nor the inoculations code, and they were leaving significant profits on the table each year. So we were able to see that, find that, prove it up, and capture that value at the transaction. You know, we can't go back and capture the codes that were before, but for sure going forward. Another one that's important is incorrect contracting of providers. This actually killed a deal that I was working on. The sellers had a mid-level base center, and they had been billing them out of the supervising physician's provider number at 100% compared to 85% of the contract for mid-levels. That wiped out a significant amount of the profit and in turn killed the deal. You know, so those are just a few handful of the red flags that we've seen. We'll do some more of this Q&A and speak to more potential red flags. But again, I want to thank you for spending time with us, getting out, learning about the different steps in the process, et cetera, et cetera. If you have questions, feel free to email them to us, call us, et cetera. We'll work as hard as we can to answer those questions for you. Thanks much and have a great day.